Wel, helo yna, a diolch am ymuno efo ni yma yng Cynhadledd rithiol Plaid Cymru. It's great to have you with us in this virtual Plaid Cymru conference in a year like no other. It was inevitable, I guess, that this would be a conference like no other, and it seems quite appropriate to me that I'm here delivering a conference looking into the camera on my PC as I've been doing, it feels, for most of the year, and I'm half expecting someone to shout, "You're on mute," any second. Ydy mae wedi bod yn flwyddyn fel yr un arall, blwyddyn lle cafodd cymaint dan ni'n ei gymryd yn ganiataol yn bywydau ni i droi ar ei ben i lawr, blwyddyn o boen a galar i lawer o golli anwyliaid, ond i bawb ohono ni, blwyddyn o golli rhyddid, lle da ni wedi ildio y rhyddid hwnnw mwyn trio trechu y feirws ma ddath i'n plith ni. Mi ydi effeithio arno ni gyd mewn gwahanol ffyrdd. Dwi'n bryderus iawn am yr effaith ar les pobl sy'n fregus, pobl sydd eu hunain yn unig. Mae'r effaith economaidd, wrth gwrs, wedi bod yn drwm iawn, hynny hefyd yn ychwanegu at y pwysau ar unigolion sydd yn teimlo'r straen o golli swydd neu o redeg busnes sydd yn uchelin anodd cario ymlaen. Ond mae'r effaith ar yn gwasanaethau iechyd a gofal ni, wrth gwrs, y rhai sydd yn gweithio ynddyn nhw, pobl sydd yn dibynnu arnyn nhw am ofal, sydd angen triniaeth neu sydd ddim eto'n gwybod i bod nhw angen triniaeth yn ymhryderu fi yn fawr. Mi ofynwyd i ni yn dod i aros adre a gwarchod yr NHS, ond y gwir ydy bod y gwasanaeth iechyd wedi bod angen i warchod ers ymhell bell cyn i Covid yn cyrraedd ni. Bob geia, da ni wedi gweld gwasanaethau yn gwegian, yn methu, yn dopi. Da ni'n talu'r pris am golli cymaint o wlau cymunedol, am ganoli gwasanaethau, am fethiant i gynllunio gweithlu. This was an NHS that had already been stripped of much of its resilience, but at the onset of spring this year, a wintry chill like no other hit our precious health and care services. We saw the impact of underinvestment in intensive care, in PPE, the impact of the systematic undermining of public health. Pandemic scenario planning had shown what the weaknesses were, but the necessary action just wasn't taken. And of course, it wasn't just health. Governments had all but forgotten how important the care sector was to us. It certainly failed to realise how vulnerable the sector would be. We thanked health and care staff on our doorsteps every Thursday. At 8 o'clock, we showed our appreciation, and it was heartfelt. But what our health workers and carers really deserve to know is that they're valued enough always, not just at the time of extreme crisis like this, to be given the support and the resource that they need. Rwan gydol y pandemig yma, da ni wedi cefnogi Llywodraeth Cymru a chydweithio lle gallwn ni. Ond da ni hefyd wedi sicrhau bod ni yn sgrwtineiddio, dal i gyfri lle mae angen pwyso am well darpariaeth PPE, am brofi mewn cartrefi gofal, am ymyrraeth mwy cynnar i drin cleifion Covid, tanlinellu'r gwahaniaeth rhwng addewidion Llywodraeth am faint o brofion allan nhw i wneud, a faint oedden nhw'n ei gwneud mewn difri. Un elfen dwi'n meddwl sydd wedi bod yn gyson ydy bod Llywodraeth Cymru wedi ymateb fwyaf effeithiol pan maen nhw yn gweld bod yna werth mewn torri i cwys i hunain. Mi gefnogai i gydweithio ar draws Prydain, ar draws Ewrop, ar draws y byd i gyd, lle mae hynny'n dod a bydd. Ond dro ar ôl tro, mae rhyw orbarodrwydd i ddilyn y Llywodraeth yn Lloegr pan oedd yna ddewis amgen wedi baglu Llywodraeth Cymru. Gorddibynniaeth ar labordau Lighthouse wedi golygu bod nhw wedi methu datblygu y capacity profi yng Nghymru, capacity fysa ni'n hunain a rheolaeth drosto fo. Da ni'n gweld yn syth beth sy'n digwydd pan mae system Lighthouse yn dechrau gwegian, fel mae wedi wneud yn yr wythnosau diwethaf, ac fel y cafodd gweinidogion Llafur Cymru i rhybuddio. Da ni'n cofio bod Cymru misoedd cyntaf y pandemig wedi rhannu 10 gwaith yn fwy o offer PPE i weddill y Deyrnas Unedig nag a dderbynion i nôl, ac mae'n dda gallu helpu gwledydd eraill sydd mewn angen dim byd o gwbl yn bod ar hynny. Ond ar yr un pryd, mi oedd Adran Iechyd Lloegr wedi bod yn atal rhai cyflenwyr PPE yn Lloegr rhag rhoi offer i gartrefi gofal yng Nghymru. Ac yn fwy diweddar, dwi wedi teimlo rhwystredigaeth go iawn bod cwmni o Gymru wedi datblygu app olrhain eu hunain ar blatfform Google ag Apple, ond bod Llywodraeth Cymru yn y pen draw wedi gwrthod i gefnogi fo. A dewis yn hytrach cefnogi cael un app i Gymru a Lloegr yn lle hynny, bod problemau lu yn cael eu canfod efo hwnnw fel da ni wedi glywed yn y dyddiau diwetha. Be mae hyn yn ei ddeud wrtha i ydy bod Llywodraeth Lafur Cymru yn aml yn rhy amharod i wneud penderfyniadau dewr a bod a hyder yn y penderfyniadau hynny. I've said in previous conference speeches that I think this Labour government is too managerial. Don't get me wrong, this pandemic is one that needs careful managing, but it also requires bold thinking, and we need bold thinking and a bold vision for the future of health and care in Wales as a whole. And let me start there. Health and care. It's a given now that ideally we need to integrate the two, but yet we're not seeing the wholesale embracing of that concept of integration in Wales. Yes, there are brilliant isolated examples of cooperation. Some of that was triggered by money from the old Intermediate Care Fund that one of my predecessors, Shadow Health Minister Elin Jones, negotiated. But real integration is what we strive for still. And it's because of our determination to bring a new vision for health and care for Wales that Di Lloyd and Helen Mary Jones, as spokespeople for care and health respectively, established the Plaid Cymru Care Commission, which reported last year. Now that commission has set the foundations for a truly radical vision for the delivery of health and care in Wales. And I am immensely grateful to all the commission members for their diligent work. And it's on the basis of that work that we will establish a new seamless national health and care service for Wales, a new joined up service with a renewed emphasis on early intervention and preventative care, on promoting people's independence, that treats health and care staff equally in terms of pay and conditions, and with social care provided free at the point of need, just as healthcare is provided free. This is transformative, and it will need a transformation, a transition fund. We propose part funding that from a levy on the most unhealthy of foods, helping make Wales a healthy nation as we move from today's illness service, as it too often is, to tomorrow's health and care service. COVID has highlighted why we need this joined up way of thinking, health and care working together. And it's taught us many other things besides. The value of preventative healthcare to help guide more people to lifestyles which can help avoid some of the underlying health conditions about which we've heard so much lately. Investing in infrastructure for physical activity and sport, I promise you, will always be a priority of mine as a part of that. It's reminded us of the value of workforce. I was delighted when Plaid Cymru negotiated £7 million from Welsh Government for the establishment of medical training in Bangor. And it happened, the culmination of a long Plaid Cymru campaign. The news last weekend that early work is already being done to see how to evolve that into a fully blown North Wales School of Health and Medicine shows how right we were. Workforce planning, workforce delivery are still among our biggest challenges in health and care in Wales. Millions of pounds are still wasted on agency workers when we should be employing full-time staff. We stand by our pledge to train and recruit 1,000 additional doctors and 5,000 nurses. And the workforce needs strengthening right across the health professions. That's how, in places like Holyhead, we can make sure that we deliver the kind of primary healthcare that our communities deserve. Instead of seeing doctors leaving, some services collapsing, heaping impossible pressure on those doctors and other health professionals that remain. Let's have a health and care service that's fit for this century. And structures have to be right. Local government have proved their might in the delivery of social care during this COVID epidemic, and they will be key partners in the new integrated planning and delivery of services along a national framework. And where current health structures have failed to stand up to stress testing time and time again, well, we can't stand by and let it go on and on. In the north, the population has endured over 5 years of a health board in special measures. For 5 years, government effectively running the health board for that period has failed to get to grips with the situation. Well, I say enough is enough. For the sake of hardworking staff and patients, it's time for a new health and care landscape in the north. As a nurse, Betsy Cynhadledd will always be remembered for heroic work in the Crimean War. Let's honour her memory, but let's no longer continue to associate Betsy with a health service that isn't delivering for its people. The current health board is too big, it's too cumbersome, it's too often defaulting to a centralising agenda which undermines care for too many of the people it serves. I can promise you I'm not looking for a health reorganisation to preside over, but here's one that is well overdue. Betsy Cynhadledd has to go, and I would redesign those services in the north as health and care minister. Mae yna ddisgwyliad, dwi'n credu, na ddylen ni adael I broblemau y gogledd barhau. Ac nad I ad-drefnu ynddo fo'i hun byth yn ddigon I datrys problemau, mi allwn ni yn y gogledd rwan datblygu model newydd, model sy'n dilifro ar gyfer cleifion o Wrecsam I Aberdaron, neith arwain ar arloesi mewn darparu gofal dwyieithog yn y gogledd orllewin, mewn darparu gofal iechyd I ardaloedd gwledig, a fydd yn gallu dilifro yr integreiddion a da ni am I weld dan fframwaith y gwasanaeth iechyd a gofal cenedlaethol newydd. Heddiw wrth gwrs Covid ydy'r her sy'n yn wynebu ni gyd, lle bynnag gyda ni. Yr her o adfer gwasanaethau, adfer sgrinio a diagnosis, adfer triniaethau, gwaith sy'n digwydd yn llawer rhy ara o hyd. A gwneud hynny tra ar yr un pryd yn delio efo pandemig sydd yn dangos I ddannedd eto. Mae ganddo ni adnodd mor werthfawr yn pobol ni sy'n dilifro gwasanaethau iechyd a gofal bob dydd yn ddiflino. Gadwch I ni roi'r diolch mwyaf allwn ni iddyn nhw. Through our actions, let us show our real appreciation for our health and care staff and real determination to deliver for patients and the Welsh population as a whole by making sure that they are at the heart of our plans for Plaid Cymru in government. Diolch yn fawr.